Hi, I'm Dr. Petty with Carolina Chiropractic. Today I'm here with a client that is presenting with a low back pain. And you've had this going on for a few months and everything else. Tell us a little bit about it.
So I went to have an MRI done right before Christmas and found out that I had a herniated disc, L5S1, and I was doing pretty good. Had been doing some decompression stretches and stuff during my workouts and after my workouts, and it seemed to be helping. The doctor had prescribed me a bunch of pain medicine, and I wasn't a fan of taking pain pills. So I was trying to do more stretching and stuff like that until last Friday. I did some deadlifts and tweaked my back. So
Okay. Right. Yeah. Now, your disc herniation, if you don't mind me saying, is L5S1.
Yeah.
And you were working out, and it would like give you some issues or whatever else. But until you started deadlifting on Friday, it wasn't hurting that bad. And you've had history in the past of back issues and everything else. And so that's fine. I've kind of already assessed him a little bit off camera to save a little bit of time. So what we're going to do is we're going to adjust him, and then we're going to KT tape and everything. So let me have you line on your stomach for me. All right. So real simple, real easy. Tell me if anything hurts when I'm doing it, if it feels better, or any of that stuff. Okay?
Gotcha.
Alright. Now you work predominantly at a desk job, correct?
Yes.
Okay. But you love to work out, not?
Yeah.
If your back would allow you, you would do a lot of lifting, correct?
Absolutely.
Yeah. And so we've got to get you back to functional and out of pain and everything so that it doesn't continue to bother you. But you okay?
Yep.
Good. Just loosening the muscles up makes it a little bit easier to adjust. Now, mid back, neck, any of that causing you any issues here lately or not?
No, really lower.
Okay, all right. Sometimes that will, just based off of foundational issues and such. You right there, pretty tender?
Yeah.
Okay. All right, so what you're gonna do is you're gonna take a deep breath in. You're gonna let it all the way out. Good. Good. All right. So we're gonna distract your back just a little bit to kind of decompress this spine some. How's that?
Good.
Okay. How did you breathe in there?
Yeah.
Oh, that was a sigh of relief. Usually you hold your breath when it hurts. But. Alright, now we're going to just kind of traction it out just a little bit more. Let's wrap your legs in. A little more traction, correct?
Yeah.
Good?
Yep.
Okay. Now, do you feel it more one-sided or anything? Or is it pretty standard for you?
Normally it's more on the left side, but here lately it's been, kind of just in the center.
Okay. And so the L5S1 disc is the very last disc in the back. It is actually the most common herniated disc in a lumbar spine for a male. Females, for whatever reason, the most common one is L4, L5. And so it doesn't surprise me. You're young, you're pretty active, especially like heavy lifting. Discs are pretty well hydrated. It's actually more common for you to herniated disc than I'm going to say a 60-year-old because they have less fluid in their disc and everything else. All right, let me have you line on your side facing me. All And did they tell you what kind of surgery they wanted to do or not?
Not really.
Alright, you're gonna just breathe in and out and relax. Good. And we'll tell the other side.
They had set up plates and screws and all that good stuff, so.
Come in close if you don't mind. And just relax right here, nice and easy. Good. I'm not even. They said what now? You said they said what about this?
Plates and screws. And
Plates? Oh, yeah, lots of hardware and everything. That sounds difficult.
Or they said they could kind of like shave a piece of, I guess, bone off or something.
Mm-hmm. Yeah, sorry, I'll leave you a little space and I'll feel like that. But. I was gonna say, yeah, come in close if you don't want. And just relax right there, nice and easy. Relax right. Good. Alright, I'm gonna help you up. I'm gonna have you stand up and around and I'm gonna KT tape you.
Okay.
Tell me how that feels.
Better.
Right?
Yeah, really, that's like right here.
Good,
Yeah.
good. Not grabbing on you or anything like that, you know.
You can actually move.
Yeah, just touch it. Get your hands past your knees now.
Yes.
Great.
Yeah.
Okay. All right. What I'm going to do is I'm going to spray you with alcohol, take off any lotion or sweat or anything like that on your skin, and then we're going to tape you. Okay?
Sounds good.
I'm going to lower the pants just a touch. Is that okay?
That's fine.
Okay. All right. Not too much. Just a little bit. It's going to be cold. Come at you in 3, 2, 1. You okay?
Yeah.
And then I'm just going to wipe all this off of you. And we're going to take the first strip, come on in. We're going to just do a decompression. The tape that I use is a TheraBand tape, and so it has these little octagons on it. And you can see that they start at an acute angle, and as you pull them, they stretch out. And so like there's a little guide that tells you about how much percentage you're stretching and everything else. But what we're going to do is do a decompression strip here. Just kind of tear it down the middle. And then what we're going to do is going to stretch and lay it down. And then we're going to lay it down at the ends with no stretch in that last inch or so. Then I'm going to do a X pattern, kind of like this. So it's going to end up like an asterisk. So in order to do so, I just kind of take this and tear it here. We want to put this decompression pretty much right over where that herniation is. And we're going to kind of stretch that just a little bit, not too much because he's already laying down. And so you got to be in a seated position. You stretch it a little bit more. Laying down when it's neutral, I don't stretch it too crazy much. Now, some techniques that you will study with KT taping, let's say not to stretch, but to move the body and all this stuff. I have done rock tape, I've done KT tape, I've done all of them. And I honestly use a little bit of every one of them for different things because I find that that works best. You know, I've been doing this for over 11 years, and so now I feel like having kind of tailored with a couple different ones, you can kind of feel what's works better for you. Stand up for me again if you don't mind. See how that feels. Supported?
Yeah.
Yeah.
Like, oh, I'm there.
Leave it down, put that leg down, everything else there. Good, good. All right. Any questions or comments, please put those below. Let us know. So hit that subscribe button and turn on those bell notifications. Thank you.